Not sure this is going to go ahead.
Is it just the two of us?
There's three of us. We've got you, Nasrat, and me.
I think it was too soon after the Easter weekend. I think people
Well,
haven't actually.
that's what I was thinking, because a lot of people, certainly in the UK, will be away.
Yeah.
So, because I don't know about in South Africa, but here, because we hardly have any bank holidays anyway.
Yeah.
So having
Same.
Friday off and Monday off,
Yeah.
people tend to take the 2 weeks out, so they get a 2 week holiday, but don't have to take the full 2 weeks.
Yeah, well, the weekend is very popular to go away on Friday and then on Thursday night and get back like last night. So they wouldn't have touched their computers at all.
Yeah, and a lot of people here will go away, as I say, for that 2 weeks. It's one of our big, hey,
Because it's
let's
school
everyone fly
holidays as
away.
well.
Yes, so it's half term for us. Or full term, I can't even remember which one it is now.
Half term.
Half term. So yeah. Hi, Nasrat. There's only the three of us, Nasrat.
Hi, Peter. Hi, Riska.
Hi,
Well,
Nasrat.
we only actually had 2 people registered for the course. So, and I thought, well, look, I'll still run it because they might be interested enough to sign up. But it doesn't look like they're turning up.
Yeah, maybe we should do it later. Or maybe try and do it on a weekend.
It's always difficult at weekends because usually I'm
in the afternoon.
Depends, because that'll only make the UK and the sort of European contingency get there. I don't know.
Evening in Malaysia and
Yeah, very
late evening in Australia if we do it
yeah.
at about 2, I think 2 to 3.
Yeah, because it's
That could be
9:30
a good.
9:30 at the moment in the evening in Sydney. And that'll be 9:30 at night in KL or in Malaysia. Got someone coming in.
Jessie from Malaysia.
So
I think we should wait. We should wait for a while.
Oh yeah, we will. We will.
Hi, Jessie.
Hi, Jessie.
Hi,
Welcome
Peter.
to
How are you?
I'm good. I'm good.
Excellent. We were just saying I think there's a lot of people away on their Easter holidays here. So not many people seem to be joining us at the moment, but we'll wait and see if there aren't that many people. I can chat with you about what the ABP entails. Get a private preview.
Okay, so yeah, I think I mentioned to you that I have a part-time parenting coach, which I specifically help parents with children with screen addictions. So like I mentioned before, the programs bring tremendous success to the people that I've actually worked with, but like not many parents will be want to do the work, and that's why I was actually thinking that. And I was actually interested to pursue the advanced diploma, but but at the same time I'm also starting my practice, so I need time to market myself, getting leads, and also doing the therapy. So I will be pursuing one by one instead of like all in a go.
Yeah.
So the first one that I'm interested is the ABBP, because I am more to the addictions, and right now I think I've actually searched the ChatGPT and asked them to research for me, and apparently the kids problem in this era, apparently the first one that really brings, the parents to seek for solution is actually anxiety and emotional dysregulation. Actually, that's the first one. In fact, the screen addiction is, I think, the second or third.
It's interesting because I think what kids are not getting the help that they need, as you all know. So they seek help from elsewhere, as in drugs, alcohol, whatever it might be, or sexual addiction, and if they've got finance or access to their parents' credit cards, shopping addiction, so yeah, and where a lot of that unhappiness comes from are these things.
Yeah.
They're online all the time. They're on their social media, and what it does is it then tells them, you need to be like this, you need to have this, you need to be up here, and they're not. And in fact, most of the people online are not like that anyway. They present a facade that's not true, or if they're an influencer, they will end up trying to sell you something anyway and pretend that they are this brilliant person. So that's a lot of where it comes from, certainly. And also
Yes. Yeah.
with ADHD as well, when you get people with ADHD, which is something we talk about on the course, they try and find some form of medication that will help them. So they'll go for the stimulants because Ritalin is a stimulant, stimulates the prefrontal cortex. They're hyper because what you tend to find is their prefrontal cortex is understimulated. So they go and find a stimulant that, boom, focuses them. And Ritalin itself is a stimulant, which a lot of people don't realize. But also the other problem is kids on Ritalin and adults on Ritalin realize that they are a stimulant and sell them as drugs of abuse to friends and other people. So that is the gateway into drug issues.
Yes. You mentioned about the ADHD. So I was actually doing the parenting coach, and a lot of parents come to me, and many of them actually with ADHD issues, and interestingly, I have one client. She's ADHD, and obviously her children is also ADHD, but she's on the high functional ADHD. It's not that
Right, yeah.
Yeah. So she has a lot of problems with the screen addictions, and that's where she come to me, and we put on the coaching to help her. But screen addiction is also one way that they can regulate their ADHD kids, because they have no idea how to deal with it. There's a lot of dopamine, and they just do not know how to of course, structure. You need structure, you need boundaries, but I think that they also do not know what they can do, and sometimes giving them the screens is the easiest things to do.
Yeah, well, it keeps them quiet.
Yes.
And it's easy to give them that, and because it's being their, I suppose at one level their behavior is being rewarded by something like they like doing, which is going online. That means they want to go back, and that's where that addiction comes from. Because you're getting you're getting the challenging behavior, which is not wrong, it's nature of what's going on within their mind. But the problem there is you've also got the fact that they're being told off for their challenging behavior, and therefore that behavior is being rewarded when they're getting to go onto their mobiles. Therefore they create that cycle: misbehave, get told off, get given the phone that they want to use, and as you say, and the whole dopamine thing starts to come in as well. So
So, like from, I think I go through some other, I went into attend EMDR as well. Like, I think last week it was by Bill Frost.
yeah.
So glad to see him again. And then, and EMDR, I think it's widely recognized. So it's
Oh,
also
very
something
much.
that like, yeah. So I'm also like thinking, like if from my perspective, if let's say I'm actually choose, like my niche was most probably with children with anxiety and behavioral problems or emotional dysregulations and screen addictions, which one should I pursue first? Because at the end I will pursue all four, but I can only have time to pursue one at a time. And with like I really got my exam, I know the case study which I passed, so it's just waiting the the certificate to be delivered by end of this month, so that I can call myself I'm a clinical hypnotherapist. But there's still a long way to go. Like I think I most probably have to work with start searching for people to work with kids, so that I have some testimonials and case studies that is actually proven in
Yeah.
and all that, and also to establish myself as the authority in this line. And then like because of the limited time, like I said, when I'm starting out, you have to do the marketing. You're the one man woman show lah. You are the marketer, you are the salespeople, you are the
Yep.
you are the therapist. Like, so I think limited time. So I'm also like thinking EMDR seems to be but ABPP, if let's say I still have the feeling that ABPP will be the right one for me, but I just thought maybe you can actually share with me what are your thoughts.
That's a difficult one because both will be very good. You've got two elements, and I'll just say hi, Artie. How are you? Welcome to our preview.
Hi, Peter. Sorry, I
Hi.
can't have my video on. I'm actually traveling back at the moment,
No problem.
from Australia. Yeah, but I did want to join in on this because I have some similar confusions to Jesse, but for a different course, different short course. Yeah.
Okay, no problem. We will discuss.
Yep.
So with Jesse, with what you were saying now, either it depends where you're wanting to start, because with the ABPP you're going to get the addiction, you're going to get a couple of techniques there that will also help within the quantum psychology field that we've got coming up. Within it you've also got the bereavement element here, which, as children with challenging behaviours, sometimes it's a result of childhood bereavement. Their behaviours are seen to be challenging because they're attention seeking, and I don't mean that in any negative way. It's just they've lost their parent or parents and they're getting that attention.
And sometimes could be grandparents, because it reminds me of like the same child that I speaks to you. When we do the coaching as the parents, the mother actually go through with him. He realized that he was dealing with bereavement, like the beloved grandfather passed away and he was very close with them. And then at the same time, the dog also passed away, which is also someone dear to him. So, he has a lot of challenges. And at the same time, like the mom and the dad actually got separated. There's a lot of things happen at the same time. Bereavement, things change, and plus he's ADHD and he was given screens in the beginning when he was young. So it's like the last, like it's the autopilot stuff that, I'm not happy. I'm just with the screens. I'll be happy, that kind of stuff.
Doesn't necessarily make them happy. It just blinkers them into their own on-screen social media world, where your life is determined by TikTok or whatever. So you got that element there. Also, it's just thinking about as well with kids. It's about helping them to wean themselves off the screen addiction. And again, this is where the two courses come into a balance here, because with EMDR you've got your ability to work on the anxiety, help to reduce the anxiety. You've got your ability to help them connect with more coping strategies. We have RDI on that, but then you've also got on ABPP the quantum psychology stuff, which is kind of, it's kids love it because it's all about energy and imagining the world as energy. It could be very visual, experiential in that respect, and that can be used as a coping strategy at any particular moment in time. So with both of the courses, it's right. What is your prime interest, first and foremost? Where is it? What door are you wanting to open first?
I think because I've been established myself as the the parenting coach on the screen addiction, so I think it's easier to like put something that I'm already like established rather than. But of course, if I check with the ChatGPT and I ask them to research from all the sources, Reddit, Facebook groups, and all that, the number one that they give me is the children's anxiety and emotional dysregulations. That the first one actually come across, and they mark it will be the 10 out of 10 if let's say the parents are willing to pay. Screen addictions I think is number 2, and maybe the rating is like 8 out of 10. And I've been working with these people before, and sometimes they maybe they could be spending 8 hours, 9 hours sometimes, but but the pain is not like apparent. Then they will choose to hold on. I will just wait. And speaking from experience with the parents who enroll with me, usually they are very in desperate. I have to say, it's really desperate time that then only they say, okay, I have to change.
Well, essentially, I mean, you've got, one could argue the screen addiction is a symptom of the main symptom. So again, with the ABPP, you're going to get techniques that will manage the anxiety in quite an interesting way. With EMDR, you've got techniques that will manage anxiety in an interesting way.
What are the difference, if you don't mind? Because you give me, because when I look at the preview, the course which Nasrat sent to me, I see that in the ABPP there is like the anxiety, depressions, ADHD, and that's why that is something that so it seems to be something I've been listening to the parents that told me that they have ADHD, anxiety, and they suspect they could be depressed, like all this stuff. But I'm just wondering what will be the difference between the anxiety, like the techniques in the anxiety, dealing with anxiety in EMDR, right? And the techniques dealing with anxiety in ABPP. What will be the difference?
Okay, so EMDR is a very structured protocol, a very structured protocol. There are very specific steps that you go through, very specific elements that you target and you connect with. Whereas in ABPP, it's more within the hypnosis element of what we're doing. So it's very hypnotic. So you've got the quantum psychology approaches, excellent with anxiety and excellent with helping people to calm down. But they're very metaphorical in their approach. There's a lot of metaphor done in the altered state. Whereas with EMDR, you're doing the eye movements, close your eyes, what comes to your mind now, open your eyes, stay with that. So they are different courses, they are different protocols. EMDR, as I say, is a very structured protocol. It challenges very specific elements. It challenges affect, the feeling as they think about it. It challenges the belief about the feeling. It also challenges body sensation, so body memory that might be held with regard to that. With the ABPP, with the techniques we're teaching on there, so we have something called advanced pseudo-regressive therapy. Not that you really regress a child, but if it was something they were talking about with regard to a recent upset, then we have the advanced pseudo-regressive, where you have them in the present, you guide them into the future where everything is great, everything's changed, pick up the future person and bring them back to the present with the client. Then the future person and the client then regress back to just before an event started to be supportive with the client as they're going through that event. And so there is a role to play there with regard to that. We've also got EMDR is very in your face with things like on the ABPP, we'll talk about apposition of opposites, which is basically where you don't need to know what the problem is, don't need to know what the solution is, but you can just imagine the problem and imagine the solution and feel the weight of the problem and the lightness of the solution. It's very Ericksonian, and it's allowing the person to rebalance quite deeply as they bring about a balance with a new way of thinking and feeling. So you've got a very hypnotic approach with regard to that. You've got the challenges. We still do challenge the thinking, the negative connotations, the negative cognitions as well. The solution focused therapy. Now, on every one of our EMDR, ABPP, ego states, and all the others, we have solution focused therapy, which is a very, it's brilliant. It's a therapy in its own right. Now we're giving skills and techniques from it on all the other courses. In the ABPP, we give the same that the other courses get, but there's also the part of the course where we do this in hypnosis as well, which again is a great thing when you're working with children, because they don't necessarily want to be focusing on their challenging behaviors. They want to be focusing on positive things in the future, and you get them to talk about the positives. Don't really mention problems with solution focused approaches. We're also bringing in the element of positive psychology within all of that as well. So you've got the solution focused therapy, solution focused hypnotherapy, which helps build, as opposed to what kids don't like doing, look at the past. So there's a strong element of coming in with that. We'll also, perhaps not so much with kids, we look at codependency using the inner child model, and what that means and how to work through codependency using inner child. So those are the kind of techniques we're using. It's very hypnosis oriented, the ABPP, but there are techniques. We've got the polarity dissociation, which is a bit like apposition of opposites, but it's done out of trance. As I say, we've got the other elements, very strong solution focused element, which with regard to kids works really well.
Okay.
So EMDR is in your face, very in your face. Think about the problem, think about the worst part of that problem, notice how you're feeling, notice what you believe about yourself. Now think about what you would like to believe about yourself, which it can be adapted for kids, absolutely. And it is adapted for kids, and it's very good with kids, but it's a little bit more boom, it's there in your face. Whereas the approaches within ABPP are a little bit more gentler and more solution focused, which depends on the kid you're working with and how you like to work within that.
But based on your experience working with kids, I'm not sure whether you work with kids a lot, but I'm just assuming if you work with kids and a lot, which one do you use most? I think you were actually comprehensive because you know everything. You will actually combine everything as well. But
Yes.
like what would be the, like if let's say maybe I should actually frame it like, in terms of APPP, how much you will actually pull from APPP when you work with kids or AEMDR, if that makes sense to you.
Oh gosh, it's so difficult because I'm so integrative in my approach. I will always start within the hypnotic context. So I always start within hypnosis, especially with kids. Their imagination, get them engaged with that, because their imagination will very much be driving a lot of their behaviors and beliefs that are pushing them up. They're addicted to the screen. So I would do work with how they can get what they're wanting from other things like sport or something else. And then I would be using hypnosis with regard to that to set them up for success. Yes, I will use the MDR. There's something called the RDI, Resource Development Installation Protocol, which is not trauma-based, which is really nice at installing that. But if you go, to be honest with you, I start off with hypnosis with regard to when I'm working with children, because of their creative imagination.
Yep.
And that's where I would always start. I will then move into EMDR or even ego states work if the hypnosis isn't doing what I want it to do. As I say, keep it very positive focused. Don't dig the past up much with kids. But I do use the MDR with kids, and I find it also I'm not being much help to you, am I? Well, basically, I would say if I had the choice, when working with children, I would always be beginning the whole process using hypnotherapy. Adults, on the other hand, it depends what they bring to me, but with kids, hypnotherapy, it's creative, it's a little bit more, you can go with the flow with with hypnotherapy, and as I say, it connects with their creative mindsets. So that I would, if you were pushing me, I would start with ABPP in that respect, especially with children.
Okay.
But you also have the other element within there. We've got, as I say, we've got elements within anxiety and depression. We've also got the elements of looking at bereavement, and the bereavement protocols can be nicely adapted to working with children. And not just, obviously, when we talk about bereavement, we are several levels of bereavement. Yes, we're talking about someone dying. But also pets, also the loss of a pet, a favoured toy. If they're moving school, that bereavement, the loss of their friends, moving home, the loss, all of those elements come in. We do talk about end of life, which, unless you're working with kids going through that, but it's also useful for adults. And some of the approaches that we use there can be very much adapted without referring to someone dying, to being very positive, someone who is wanting to achieve in the future. So, as I say, you've got quantum stuff, which is a bit sort of Superman energy. We're turning everything into energy, which kids will like. Anyone they've watched Marvel films and stuff like that would work really nicely there. So kids, I have a very direct route through, always starting hypnotherapy. Adults, different, because it depends what they are bringing to the session. So
Yes, I agree. Okay, so I know I'm a bit like divert, but I'm also, because I'm also looking through all the courses. Like I was thinking the second one after I got my PPP would be integrative psychotherapy, which is more on the family side, the attachment side. That's why I was thinking the second. But after I attend the EMDR, I also like, okay, EMDR seems to be
they're all
more
very good.
yeah, but like I said, we have limited time, and also I'm building my business. I also have to do one at a
it's
time so that
it's
I have
prioritizing, I think.
yeah.
What is most important for you, which one you're going to go for first.
Yes. So I was actually, if let's say that's the direction, then most probably maybe the IP and followed by EMDR. But of course, I think the EMDR seems to be well more recognized compared with IP. So perhaps maybe after I finish IPPP, and then I should actually speak about this again. But if you think that you can offer any advice, like from which one I should go, so that it's easier for me to make the decisions.
If I'm honest with you, then it would, out of IP and EMDR, do EMDR, because when you get to the IP, I mean, you can do it right from here and now, but also IP is about how to integrate different approaches within your approach to therapy. It's the way, basically how I work. I'm a hypnotherapist by origin, but I'm an integrative psychotherapist now because I have so many different techniques, which we're now teaching. But if I were you, I would say, look, ABPP, EMDR, that route. And IP when you want to. Maybe IP next, because then you'll have the different elements there.
Okay. Then that's give me like if let's say it's ABPP, then EMDR, IP, then EST will be the last one. But at least I know the path. Then it's easier for me to plan the schedules and all that as well.
Perfect. And of course,
Okay.
you've got Nasrat here as well, and Riska, who are here to also they are course consultants, as you know. So they're here to help with that as well.
Thank you so much. I think I'm done with my questions. Maybe Artie has
Yes.
some questions as well, I think. So
Nice.
I'll back to Artie.
Thanks, Jessie. Okay, so hey, Peter. All right. Well, like Jessie, I'm still very much doing everything myself, and kind of got one foot through the door in terms of doing therapy, and one foot still in marketing, which was my background. So I used to run events in a PR agency, and right now I still do marketing consultancy. I kind of entered into this space because I've always had a passion for how the mind works and what drives behaviors and how to rewire that. And I started off with coaching. So I had an opportunity with a company to be their in-house coach, to do a lot of group coaching sessions for employees and mid-level and top-level management. So I got into that, got certified as a coach as well. And then because of my own personal experiences, I really chanced upon EMDR. And out of all the therapy in the world, I've done talk therapy and EMDR and just various other healing modalities, Reiki, sound healing, you name it, tried it all. I found EMDR to be one of the most effective ones that I had ever experienced, because the gap that I realized with talk therapy after doing it for a solid year, and I did it quite intensely, was that I was brought to an awareness of the problems, but then unable to move forward to the solutions,
Yeah.
which is what EMDR did. So after doing research, I found this school, and I saw that I could do EMDR if I completed the diploma in clinical hypnotherapy. And so what I got out of the clinical hypnotherapy course blew my mind, because I never considered clinical hypnotherapy before this. And I'm glad I did. So I've already signed on to the Addictive course now with Nasrat. And I am starting off with EMDR first. But being in this space now for about 3 years, I realized that, I want to specialize in developmental trauma, CPTSD, PTSD, grief, and domestic violence. So, circling in that. And so of late, my clients have been, I don't know how, but somehow I am attracting the ones that actually do have CPTSD or PTSD. And I've, just been doing a lot of reading and research on my own. And what I found was, while there is so much of knowledge and information about what PTSD is, and the science of trauma, there is such a slow adaptation of the knowledge and modalities to basically get through it. So I just started experimenting with a lot of stuff I even do with my clients now. Like, I've prompted some of them to do very specific journaling exercises, followed by meditation, mirror work. And I found that actually worked. And I've had good feedback from a few of them. But my thing is this, that I don't have a background in psychology or counseling. So in doing the Addictive program, I know that there was the requirement to do the 3 short courses, which were compulsory, and then to do the 4th one, which was either CBT or ABPP. And I'm just like, I know that, predominantly most counseling, most psychology courses are fundamentally based around CBT. And I don't know if I'm sort of disadvantaging myself if I don't pursue CBT, and if this is what I want to do. Even though I kind of know that, traditional talk therapy just doesn't work in any of the areas of specialization that I mentioned. It just, in fact, does the complete opposite. So yeah, I wanted to get your thoughts on that.
Well, I think there's a lot of assumption in the world out there about the centrality of CBT to everything. Yes, of course, it's an excellent therapy, but it is not the only therapy that's out there. So a lot of the things like mindfulness and ACT and the other versions of the third wave psychotherapies evolved out of CBT. We're in the so-called 4th wave at the moment, which is the more spiritual element that's coming in, because CBT ignored the spiritual, whereas a lot of trainings, including ours, fully embrace that concept of the spirit, whatever spirituality means to somebody. Now, a lot of people make the assumption spirituality equals religion, which is totally wrong.
No, yeah.
So the thing I like about what we do, and we've deliberately designed it this way, and I've deliberately brought these elements in, is it recognizes the spiritual. So with the ABPP, I was mentioning to Jessie about the quantum psychology element there, and that comes from a very, quite a spiritual concept. You've got Western psychology, Eastern philosophy, and quantum physics all coming together with regard to helping somebody overcome their particular issue. You've also got within the ABPP, you've got the element of the bereavement. And, if you're interested to, obviously you are, working with people who've gone through abusive relationships, and that type of trauma, there is definitely an element of bereavement that comes in with all of that. So it's a case of, right, where is my journey taking? By the time you get through, so you do EMDR, you do, for example, ego state,
Yeah.
they kind of connect together, but also the ego state connects in with the ABPP work, as does EMDR.
Right.
So with ego states, if you were to say to me 3 courses I should take with trauma therapy in mind, it would be EMDR, the ego states, and the ABPP. That route through, you get a very strong grounding in trauma. EMDR, we talk about trauma, ego state work, we talk about other areas of trauma. They all complement each other.
Okay. Would I be, so prior to signing on to Addictive, I was actually considering, in Malaysia, you can't, you will not get on the counseling board unless you've done a master's in counseling. And or you've done one in clinical psychology, which is not going to be possible with my background. So, but in like Australia, which is where I currently have a role with a consultancy firm here, and I travel back and forth quite a bit, they do have PACFA, which is the Psychotherapy and Counseling Association. So they have a diploma, a trauma-informed diploma, in that as well, which gets you registered on PACFA. So I was just like wondering, okay, like if I don't have that background, am I like, is there something that's missing if I've not done CBT, or if I don't know what it is, like holistically, A to Z?
CBT, it's a concept, it's an idea. We come from the REBT side of CBT. So it's about challenging beliefs, challenging beliefs, challenging mindsets, challenging the way you look at something, the catastrophizing. Elements of which we do bring in, obviously, with EMDR, ego states, ABPP, because this level of understanding of symptomology, you do need to have that challenge that comes in, that layer of challenge that comes in. But because certainly the Addictive is very trauma informed anyway, because we've got a massive amount of understanding of teaching about trauma within that. It would be interesting, perhaps, to find out a little bit more about what they want, and whether that organisation would accept people from us through our training. What was the name? Sorry, what was the name of that organisation? It's gone out of my mind.
PACFA. So PACFA Australia. So they stand for, one second. So it is the Psychotherapy and Counseling Federation of Australia. Because all the while I was looking at the Australian Counselling Association, and they had a program with Monash University in Malaysia as well, which gets you in the Lembaga Counselling Malaysia and gets you on the Australian one as well. And that's kind of how I came to like see what PACFA has to offer, and came to know that, okay, they also do have a diploma, a trauma-informed diploma in counseling, which takes, I think, about 18 months, which is not too long as well. So it was just for that. And yeah, with Addictive, I know that there is that, there are two, you would get on an international integrative psychotherapy association, and also one in the UK. So I was quite happy with that, because I mean I wasn't really keen to just do, you know, basic counseling work. Like that's not what I signed up for. Yeah.
But I think if you think about the training you've done so far, plus the training that you do here, if you think to get as far as having your getting the Addictive qualification, it's about 24 plus months of training.
Yeah.
Which is quite an in-depth training with regards to everything. So
that's probably the imposter syndrome. That's why
yes,
I'm not qualified enough.
We all have it. We all have it. The CBT people are very good at promoting themselves. But you know, it used to be, oh, hypnotherapy, you aren't any good. And now medical profession kind of pulls us in. So I think it's a case of the training. I know the training is excellent. I'm bound to say that, aren't I? But I know it is because it was the way that I was trained, and I've taken that and evolved it, certainly with the, you know, with the Addictive level courses.
Okay. So between I mean, so based on what I'm already on the path of kind of doing, and just, you know, diving deeper into, compared to CBT and ABPP, you would definitely advise ABPP.
With the journey you're on, yes.
Okay.
Because you get some very proactive stuff within the ABPP.
Okay. All right. Okay. Yeah, I think that was.
As I say, people have been traumatized. They're going to resort to drugs or other behaviors,
Alcohol, or
sexual
Addictive
issues. You know, when I've worked with people who have been sexually abused as kids, or people who have been raped, they're often given the message that you are terrible, you are this, you're dirty, no one will love you, I'm the only person who, you know, all of that. Which, yes, you can say CBT, you can challenge that. But we have excellent approaches within EMDR, within what we're talking, you know, the quantum stuff, the bereavement, the restructuring of yourself as an identity, as opposed to the identity that someone has forced on you via violent sexual trauma or violent trauma. So I would certainly pull in the ABPP.
And I definitely feel like, because I've done that coaching certification with another school in the US, they were quite extensive. So it already, like in the cases, so I kind of integrate a lot of coaching with clinical hypnotherapy now as well. And that really helps. And I am challenging their perspectives and their beliefs, and what makes them, you know, what's actually driving that, or what's the possibility if they did. So if you're telling me CBT is essentially that, then I feel like, okay, then I don't, maybe I can just pick up a book and
yes. I'm going to say, look, the course we do is excellent. It's CBT skills. It's not a full diploma in CBT. It comes from the REBT perspective. But if I'm being honest with you, the route you're on, build up on the things you've got already.
Yeah. Okay. All right. Got it.
And as I
Got it.
say, the other element of this that we bring in, yes, if you've done the MDI, you've seen the solution focused therapy module. But within the ABPP, we have a specific part of the course where we're practicing solution focused hypnotherapy. So we're bringing the solution focused model into hypnotherapy.
Hypnotherapy. Okay.
And it's also, because always remember, when we're working with traumatized people, some of them get very put off, shall we say, by the idea of having to focus on the trauma, especially, I can't tell you the number of people who've come to see me and said, look, I've been through all these therapies. All they want to talk about is the trauma, and I'm sick and tired of it. I want something else.
Yeah, exactly. That's exactly what I get as well from my clients. Like and I can understand as well. The last thing you want to do is keep talking about that traumatizing incident repeatedly. It just re-traumatizes you and puts you in a deeper sort of survival state. So they all just, they kind of just want solutions. Like, how do I get out of this? How do I move forward with my life? Yeah.
And that's where, because I mean, a lot of, as I say, with EMDR, with ego states, with the ABPP route, they all involve altered states, although EMDR and ego states does not require formal hypnosis by any means, but the approach is trigger trance. But here you've also got the other elements here. You've got the bereavement, you've got the elements that will help support people with the anxiety, the depression, and some who may be going through helping somebody through end of life. Especially if you've got somebody who's quite a heavy addict. So there's elements here that would work really well. If I had my way, I'd say, look, to all courses. But the route you're on, I think ABPP is a route through that will fit with, because you've got your coaching skills, and you're already using what I would call CBT approaches. Bring something new in.
Okay. All right. Got it. Thank you.
We've got this wonderful technique called the advanced pseudo-regressive therapy, which is great because it allows somebody to deal with the past from the perspective of having already overcome their problem in the future.
Okay.
And so it's very much, it's, foresight to have hindsight. So we see how they overcame the problem, and then that individual from the future, the client that's with you, they regress into the past to just before whatever it was happened, and then they get that sort of psychological support, so they don't go through the event just being traumatized. They've got current person, future person supporting them in that sort of mindset. So it's bringing these resources in as a very supportive way, hey, you're going to get over this. And this is how you're going to get over it, because this is what we've looked at in the future. So as opposed to I'm just going over and over and over my old trauma again, very different.
Okay, thank you. No, this was really great. That was the only thing that was in my mind, and chat with you definitely helped. Wonderful.
As I say, the whole thing, they all click together. And just, if you decide in the future you want to gain some CBT skills, uh, then of course the course CBT is still open to you.
Yeah. Yeah.
So
Can always pick it up at a later time. Yeah. Yeah. Okay. Sounds good. So much more clear now. Thank you so much, Peter.
wonderful. Well, look, anything else either of you would like to ask?
Nothing else from me. I'm all clear. I'll probably give Nasrat a breakdown of what I'm going to do first, second, third, and fourth half sometime.
That's brilliant.
Yeah.
So, and Jessie, anything else you'd like to ask before we finish? No.
So far, nothing from my side. I think I got most of the things that I need today. So thank you so much, Peter.
Wonderful. Yeah.
By the way, who will teach ABBP? Since I'm not sure whether it's the same lecturer that I've been dealing with, or it will be different lecturer.
It'll be people that you've seen before. People like myself are on it. Dr. Thamer does it. Bill will be a part of it. So there's a variety of us who teach at that level. So you get the trauma experts, basically.
Okay, great. Then I'll see you then, like in a couple of weeks' time. Okay,
Perfect.
thanks, Peter.
Wonderful.
Thanks, Peter.
Wonderful.
Thanks,
Thank you,
Nasrat.
both of you.
Thank you, Riska.
You take care, everyone.
Thank-
See you
right.
on the
Thank you,
ABPP.
Yes. Right. Bye.
Bye-bye.
Thank you.
Bye.
Good night. Bye-bye.
Bye, everyone. Bye-bye.
Bye.
Bye.